Okay.
Okay, perfect. Thank you so much. Thank you so much, Taft, and thank you, Mr. Edward. I really enjoyed the last presentation. My name is Hans Loom, originally from Gambia, West Africa. Current CEO and founder of Universal Care for Africa Foundation, which is a nonprofit organization that provides healthcare to the underprivileged in Africa. We're currently present in Ghana, Gambia, and also Kenya. As the young man also stated, Edwin, I also go back and forth from Africa to from US to Gambia and other countries. I'm also currently working on my PhD in public health. With the COVID-19 arising and many other issues, I think telehealth is becoming more of a sense of issue for all of us to utilize to help to develop the healthcare in places where doctors and different healthcare facilities would be able to reach. My little slide here, I'll go over this presentation. Telehealth is defined as the delivery and facilitation of health and health-related services. This includes medical care provider, health care education, health information services, and self-care telemedication and digital communication technologies. Okay, and here are different examples of telehealth. You have virtual home care, which is a physician or a cardiologist or a radiologist could be wherever in the world, and they could basically come to you in your home within the touch of your cell phone, your iPad, or whatever audio or communicational device you have at home. They can reach you there. They can be able to see what's going on and how they could better address and treat you. Another form of telehealth is medical care consultation, where you could a team of doctors in the United States or wherever in the world can team up with a doctor in, say, Kenya or Nigeria, Africa. They can team up, have a patient there, and they come together and try to see how best they could consult and see how they could figure out the best kind of treatment for this individual. And the last one is training healthcare workers. So not everybody has access to come overseas to get education or receive education from different countries. But with telehealth, we can be able to educate staffers on the ground in different areas, especially in rural areas. I know there are challenges to that due to a lack of internet connection. But during trial and error, we could be able to figure out how best that can work in. And then different telehealth technologies and softwares. We have mHealth, which is mobile health, and a telemedicine system, which is a web-based platform which one can utilize. And then also we have a remote patient monitor. And I'll further elaborate on that on different slides, but these are the different kind of telehealth technologies that I've touched on. Okay, so telemedicine system is a virtual consulting solution between a patient and doctor. I touched on that a little bit earlier. So pretty much a doctor, I can be home in, say, Ghana, and I have a doctor in London, get me from which specialize on a certain disease, call me from his office and talk to me at my home, and we go over what are my conditions, my symptoms, my temperature, and different things, go over different things like that to see how we can best address the care going forward. And another form too is remote patient monitoring, which is a system virtually monitored of patients' vitals by doctors, irrespective to local presence anywhere in the world. So there's software that they're developing, and it's currently being developed, that you can use, that you could check your blood pressure, your pulse. Even with our cell phones these days, you can check your pulse and different kind of stuff that's going on with your body. But through this remote patient monitoring, doctors will be able to check your weight, your respiration, temperature, hydration, brain activity, skin conduction, your blood pressure, glucose, orientation, motion, and EKG. Okay, let's see here. Thank you. And then we have the pros of implementing telehealth in Africa. Through telemedicine, geography between patients and doctors can overcome as patients can receive support from doctors from any distance. So even though you live in a rural area or you live in the city or wherever you are, you can have access to a certain kind of doctor that specializes on different kind of care or disease or whatever that is that you need to focus on. And it also, another pros to it, it also helps with the shortage of doctors, which our panel earlier focused on that. We have a big shortage of doctors in Africa. So having a system like this would help to balance the system up a little bit and also help to avoid doctors being burned out from seeing so many patients at one time. Because there are even situations where sometimes patients would complain that I went to get my blood pressure checked or get a diabetes, my blood sugar checked, and I sat in the waiting room from morning to night. I had to go home and then come the next day. So having a system like this in place would help to definitely balance the system. And here are different ratios of patients to doctors in Africa. These may not be up to date to us today, but from what I've got from different colleagues and friends, as you see in Nigeria, every one doctor to 3,500 people. The Gambia, every one doctor to 1,000 patients. Tanzania, every one doctor to 20,000 patients. In Kenya, 1 to 16,000. And kindly just put in mind that the recommended amount is 1 to 300. Okay, and then we'll go to on the benefits of telemedicine. Panel of certified doctors, accredited hospital. You get access to different doctors that are accredited from different hospitals around the world. You also have the benefits of having doctors and health professionals with very vast experience that can assist doctors on the ground with things that they don't know or things that they need help with. And then you also have different specialties that that country may not have. Example, dermatologists, maybe rare, not everybody has an access to dermatologists in certain demographical areas, but through this telehealth system, within few seconds at your home, you can be able to address and make an appointment to a dermatologist to address your care. Okay. So as an organization, we have started started rolling out this process a little bit. So part of our requirements is one is a personal computer, telephone with an active fast internet connection, proper medical documents of patients that must be up to date, and proper understanding to use the telehealth web, a system to upload medical records, documents, panel doctors to see and evaluate, and they also must comply with local and foreign healthcare norms. So every country has their own process, norms, and policy in place. When implementing this, we have to remember that we have to obey those policies and rules. And going along here, the process, the patient must be ready with soft copies of medical records. It can be uploaded in the web system, designed or emailed. And we have had experience doing this in Kenya. We've had maybe 2 or 3 patients that had a brain cancer and they couldn't afford the care. So unfortunately, the patient was dead, but we were able to take the patient's results that they were getting from Kenya and send it to a doctor in India to prior see what we could do to help that patient. But unfortunately, by the time the process had gone to a certain level, the patient was lost. Okay, thank you. And also, okay, thank you. Okay, and okay, as a role, as I mentioned, Universal Care, along with Medobal Health, which is they're in partnership with us to implement telehealth project in Africa. This query raised by patient will be addressed to the relevant panel of doctors at accredited hospitals. The process of following up with doctors, hospitals for opinions, that process has already been kicked off. Telemedicine is scheduled between patient and doctor, peer-to-peer communication, so you can fill in to jump into a the software and schedule anytime an appointment. It's available 24/7 to you. You can schedule an appointment and go from there. Okay. All right. And then we also can provide specialists and different tele consultation to be charged at a minimal cost. So it can be affordable to everybody. But there can be also structures where we have in place where if some people cannot really meet the charge, we can be able to give discount and also be able to see what we can put in place to help with the charges. Okay, and then here are some of the more advantages for having a telehealth system. Easier and quicker means of consultation to both the patients, doctors, and hospital. Increase the knowledge for local healthcare service providers. The latest trends in the sector will be learned and monitored. The medical inquiries generated could be recorded, and medical history could be accessed by patient doctor for future references in case they need to follow back to it. Hospitals in Africa with this system would easily promote medical tourism from neighboring countries to treat other patients. And then lastly, we'll provide telemedicine system at affordable minimal cost to perform setup and doctor consultation, so everybody does have access to it. And the vision here is to provide specialties consultation to African patients, physicians, doctors across the globe, reaching out to patients in interior African regions as they require the quality of healthcare in easier way as possible, and also increase peer-to-peer consult to privacy is maintained, and then to serve the people with Africa and advanced medical treatment at the right moment. And here is just a little slide on telehealth and how one can use it. Here it says telehealth works in combination face-to-face appointments, reduce the burden of travel, improves access for people in rural, remote areas, it reduces accommodation, parking costs, reduces stress and waiting times. You can access for mental health services, career services, rehab services, and after hours GP appointments. And that is it.
Thank you so much, Hans, for keeping to time in terms of your presentation. I'd like to open the floor briefly. If you could use the raise the hand function. Yes, Brenda, 1 second. You're unmuted.
Okay. Thank you so much. I mean, that was informative. Very, very interested in that. What I wanted to ask is, you know, I was interested in the fact that you're saying you already have this. You've used this in Kenya. So what I wanted to find out is, so one of our partners at Delio is based in Kenya. So they called Narita Technologies. So they developed an app that is also to help with emergency situation alerts, and where you can, you know, connect with the different facilities, medical facility, to say, you know, I am sick, please come in and give it. Is it able to integrate with such systems? That's the first thing that I need to understand. The second thing is, as far as your requirements are concerned, I see there's a lot of requirements that, you know, a lot of African citizens might not be able to meet. You're talking about smartphones, you're talking about being able to being computer literate, you know, is there a version that requires, you know, lower level, that has lower level requirements or minimal requirements?
Okay, and that's a great question, and that's one of the challenges actually we faced. So what we've done is we've worked with local clinics that are in community. I'm not sure if you're familiar with Kibera in Kenya. Hello? Oh. Hello?
Brenda, are you still there?
Okay.
I think we may have lost her. The connection may be a bit.
Okay, so to answer, I'll start with that last question. So to address that, I think what we have been doing and will doing is you have clinics in the community that people normally can go to, and once they're there, they can be assisted with that, and with the internet access and stuff like that. And they also have a doctor there that will be able to help them, you know, either with their language or have somebody that will be able to translate into their language to be able to translate with the doctor from wherever they may be, India, London, or Germany, or the United States. But also that's a big, because also too, we have to figure out ways to address different cultural differences. Like in some cultures, you're able to do certain things, and other cultures, you're not able to do that thing. So we have people on the ground that help to do, help translate, and also help us, what are their norms communication-wise, and also help with access to a cell phone or a laptop or a computer, or the least way of communication that they can communicate. I think with today, though, I think most people have access to some kind of technology. Even if you drive to the rural areas in Africa, you'll see most people using maybe what's not all, but some will have access to WhatsApp and different things like that. So I don't know if I was able to answer. Brenda?
I think we may have lost Brenda. I think her connection is gone. Okay. Were there any other questions, perhaps, whilst we wait for Brenda to return? If you could put your hand up, that would be good. Or raise a hand.
And Edward, it's a really quick. It's we're open. We want other people to be part of this. So if anybody's interested, they're more than welcome to be part of this and see how we could improve it, and provide feedbacks on how we can all work together to help improve healthcare in Africa. So if you have any suggestions, feedbacks, or concerns, I want to be part of it, please let us know. Excellent.
Well, I think through the TAFFD platform, we've made connections on LinkedIn and various other social media. So hopefully we can start to have a wider dialogue amongst those that are interested in these topics. And obviously, if the discussions of the previous panel or anything to go by, then obviously there's a lot of insight and views across African nations as to what can be done and what are the barriers. So we're just adding someone else. I wasn't sure if that's Brenda rejoining us. It wasn't the same name.
It wasn't. Okay.
Okay. Okay. No, I'm not sure. They're not connected on audio at the moment, only on video. So from what I can see from my control panel.
Okay.
So that's unfortunate. Hans, thank you so much for sharing the work that you've been doing with Universal Care in the Universal Care area for Africa Foundation. and obviously, you know, there's still a lot that you know, needs to be done. I think the numbers that you showed, even though they might be out of date, you know, by a factor of 1,000 out in number of ratios of doctors to patients, you know, even if the numbers are you know 10%, you know, or 50% out, we're still a long way from what it should be. What I'm trying to say. I think that's what your presentation highlights, and therefore the benefits. For instance, I think yesterday we had a session with I forget the chap's surname, and he's a scientific officer with the US NIH.
Okay.
And he's specifically doing AI research, and some of the advancements that he was explaining with regard to triage. Being able to triage where you have a severe shortage of doctors, so that you could at least do the triage and have, especially with some of these, you know, treatable conditions, could be triaged, and then that frees up the resources on the doctors themselves. Whilst you know, he said that, you know, where you've got the ratios in the US and perhaps Western European countries, that 300 or 1 to 300, one doctor to 300, you know, there's a bit of pushback to say, well, we don't need all that triage. But in those countries where you have a severe shortage of qualified doctors, that can only be a good thing.
Yeah, especially in the rural areas too.
Well, thank you, Hans. I think we have Alexander is going to be joining us. I just saw a message to say that he's ready, but he's not yet on the bridge.
Okay.
To start. So what I propose is I'll just pause the session until he joins, and then we can reconvene with his presentation. Hans, you're an absolute star. Thank you very much for your contribution and ongoing dialogue, and let's hope this is the start of much further discussions that we have.
Yep. Okay, thanks for having me, Edward.
Thank you.
Thank you so much.
Even most people are on video, no video, they can't give an applause, but I'll give it on their behalf. Thank you very much.
All right, thank you.
Okay, so we're going to take a short break now of a few minutes while we wait for Alexander, our next presenter, to join us.